we're just going through this little checklist. And then one of the things that we do is we kind of look at each other and say, I have no more questions. Then we ask the candidate to step out in the hallway for a few minutes. We also caution them that they may come back for more questions, but it's not a reflection on what they did. It's a reflection on us, because we have to make sure that we've gone through that whole checklist so that we can make some sort of a recommendation. So what we tell her to do is to pick up all of her stuff and to leave, and then one of us will come out and we'll let her know whether we need her to come back or whether it's time to go. And then we'll let her know that she'll hear something within 2 weeks from the certification commission about, what's happened today. Is that about right?
That's about right. The thing to remember too is though, each interview is kind of organic in many ways, so it's not going to always be the same. So you may have a coworker come back and go, they got stuck on this, this, and this, which may be true, and then you may not even have a question about that. So it's really important to make sure that you're knowledgeable in the areas connected to your presentation. And if you cover what you cover in that presentation, is going to be how you kind of start off. Does that make sense? If you talk about those exceptions, and you talk about the different pieces of the diagnosis, that's going to help your whole process. And you're able to put those all in that 10 minutes.
Sometimes we get cases that come to us where it's like we got an abuse diagnosis. Well, it's not abuse anymore, is it? No. Substance use disorder, mild diagnosis. And so the thing is we're going to probably ask questions to find out about, substance use disorder severe. If somebody's normally used to working in an outpatient world, we're going to ask them questions about how might you do something in an inpatient world, or thinking about that ASAM. We didn't spend a lot of time talking about ASAM.
She did a really good job.
She did a great job with it.
So we didn't have to.
But if it was very clear that, we're talking about, an outpatient, we might ask her what might ASAM look like for a person that might need a higher level of care. And for her just to let us know, the kind of considerations that she takes into account to think about that. We also, like I said, we started asking questions about adolescents and if you're normally working with adolescents, we'll probably say, ask questions about adult population. So sometimes it's just taking you away from your comfort zone just to see if you hung that shingle on your door away from an agency where you didn't have all of that support, are you going to be able to function?
Because this isn't about us seeing if you can do your job. This is about us seeing if you qualify for the certification. So there's no doubt you can do your job. We just want to be able to know that you meet that expectation of being able to do this anywhere and everywhere.
And one of the other things, and I'm sure that some of this was touched on earlier this afternoon, but we also, and in the presentation, there was talk about where that person was in their change process. We sometimes, when we get to talking about treatment plans, we ask them, might this treatment plan look different if a person was in a different stage of change, just to see how you might work with a person differently, again, depending upon where they are. I think Andrea wrote up her case presentation just this afternoon to come in here, and no sooner than that. So her case presentation was written in an afternoon. So, anyway.
Another important thing, do not give us a philosophy of treatment that you cannot explain.
Right. Right.
And explain well, not just like what it is, but how you do it, some examples of what you do,
If you're doing Gestalt and trans analysis, you better be able to explain Gestalt and trans analysis.
Yeah, it's something that happened real recently, and it happened a long time ago. Somebody said that they did reality therapy. And I'll give you the aged-old reply, and not the most recent. But it said, tell me a little bit about reality therapy. How would I know if I was flying the wall that you were doing you were doing interventions that clearly came from reality therapy? And the woman said, I just like my clients to get real. So if you say that you're going to that you do something, please understand what it is, because it's a big problem when you don't. So.
Just to reintroduce myself, and again, I apologize for being a little tardy because I was literally just upstairs like this and rehearsing it, like trying to time myself. So that's what I
And
was
she had a
doing.
minute to go.
Yeah.
Great.
Yeah, I was timing myself, but I am new to the Certification Commission. I just joined this year, and I can just say how much of an awesome learning experience it has been for me. But what I am seeing too is a lot of the same things that they're saying, as well as people who are particularly in outpatient services that may be used to doing level 1 services that don't take advantage of sitting in other levels of care, particularly IOPs. So if you have IOPs at your agencies, just try to make it your business and talk with your clinical or administrative supervisor about making arrangements so that that becomes a little more of a priority for you. Because there are times you can see where people give really good cases, but you can tell they don't facilitate the service because they may be a little bit challenged with talking about the differences between a level 2.1 treatment plan versus a level 1 treatment plan, things like that. So if you have an IOP, because there are some agencies in the state that don't, and I'm just talking primarily 301 behavioral health agencies, if you work in other settings, just try to collaborate, reach out to some of your colleagues in the field and know, if you're able to access that from time to time, so that you can kind of see how it works, get a feel of the language, the expectations and things like that, so that you can feel a little more comfortable with your case presentation if you are presenting someone who is in level 2.1 services. So I would highly recommend that as well.
One other thing that I wanted to say is that it's always recommended that you do practice and that you do present your case and that you boil it down to 10 minutes, because I just know me, if I didn't finish my case, my anxiety is even going to go higher. So make sure that you get it done. Make sure you cover all of, your little note card. It's like, screening, intake, orientation, assessment, exactly. And that you have something there to refer to. We don't let people read to us. We ask them to use it as a reference. And then after the 10 minutes is done, we ask them to put it away, and that's when the questions start. The other thing I'm going to suggest is that you do get a mock oral interview before you go up for your interview. That's something that you can probably do at your organization with your clinical supervisor. If you don't have the resources there to do it, I know in Region 4, that's my region, that I've had people come up from Beaufort County. I live in Charleston. They've come up from Beaufort. They've come from methadone clinics that were local that weren't part of my agency, and we'll accommodate that because we have 2 members from the 3 members of the Certification Commission that live in Charleston. So we band together and we'll do an oral interview for anybody that's coming up that needs it. And I at my organization we require it. Everybody that's going to go up for an oral interview or to do their oral exam is going to go through a mock oral because we see the benefit in doing that. And we're not going to tell them, this is the answer for what you missed. We send them out doing the research. It's like, talk to 3 people and ask them what they would do in the situation. Go to research this and come back to us. We're just not going to give them the answers. And the candidates that have gone through those processes said that they thought that was extremely helpful for them. I think we've had 1 person probably in the last 7 or 8 years that did not pass, maybe 2, their oral interview, but our fail rate before we did the mock orals was higher than that. So I think that there's a lot of value in practice.
And one of the resources is the website, because all of the commissioners' names is back there. So if you're in that region, you can make contact. That person, of course, will not be part of your oral when you do it, but help and resources is there.
Okay. Jill.
I noticed this in the previous session that we had.
Oh yeah, that's really good.
Yeah, I have a Facebook page for those who are in process. It's CAC's, help me out.
Study group.
CAC study group.
CAC study group
Oh,
on
okay.
Facebook.
So I post helpful information, some study tips, some sample questions, and try to do that a couple times a week. But it's also a nice community of others working towards the same goal.
Are there any other questions? Are there any questions?
How long was the whole interview itself?
Well, it does vary. We have it scheduled, so it's like if one person starts at 10:15, the next person's supposed to come in at 11:15. Guilty as charged this last week Thursday, Shannon, right? We had the boardroom, and so everybody was waiting from their suites to come and join in there.
Nobody had the
They had to
boardroom.
wait outside because we were chronically late on all of our interviews, except for Sandra. Sandra is good, but the rest of them.
But we would like to say that you guys, who are candidates, can help with it staying on time. Your presentation
Yes.
helps with how the process moves along.
Yes.
So the less you tell us, the more we ask.
Right.
Yeah, we had somebody who basically, it's like 10 minutes was up and they hadn't even got done, they hadn't even told us, they hadn't even finished their assessment with us because they were just, it was just, the detail was just exceptionally long and we didn't need all that. Time yourself. Yeah.
So just treat it like you're staffing a case when you go to staff, and that's all we're doing.
Exactly.
Just one more tip too, if you get stuck in the interview and you're thinking and you just can't come up with what it is, don't think about what we're looking for. Think about what you really do on a daily basis. Think about you doing your job, not what we're trying to get you to say.
And something else that sometimes sounds like, I'm just blanking on that right now. Can we move on and maybe come back to that? Sure, we can do that. That's not a problem because we've all been in that chair. We all know what that feels like. And if there's anything that we can do to help you get through it, to do your job, we'll do it. But at the same time, we still have our job to do. So we're going to need to get that information, but at a pace, it's like, right now I just can't, we feed a dead horse and I can't get through this. Let's pause on this for a minute and come back later and maybe subconsciously something's cooking and it'll come back and we revisit it. I'm not sure. But we're trying, if you say I need a break, I need a glass of water or anything like that. We had someone the other day that said, I need a timeout for a few minutes. And we said, okay, that's okay. Ask for what you need.
Just don't ask.
Barbara,
No, I know Andrea.
What did she say?
what'd you
That's for
say?
the
I said,
answer.
just don't answer the
Can we ask you at the end of the interview?
Oh, hang on one second. Barbara, you
Oh,
have
not even one of these?
I know that Andrea just wrote her case, so she read it. But you would probably stop her if anyone in here prepared and was reading. I just want to point that out so they don't think they can read it.
Exactly. I think this is one of the reasons why I mentioned that. We don't want you just to read to us. We really want you to talk with us. Yeah. Yeah.
And use it more as a reference, because what I've seen is people who know their case so well, they are really able to fluidly talk about it and just kind of have their note cards if they get stuck or just kind of feel like they're getting a little off track and they have something just with a few lines written on there. But most folks who are pretty familiar with their cases, they just really don't need the note cards, but I think it helps them to have a little sense of security.
And I think that's a really key thing that you said, a few lines, a few bullet points. Because if you write it out narratively, you're probably going to be more reliant on it. If you put some bullet points on there, that'll be easier for you.
Right.
I think. You had a question?
She answered.
She said she couldn't get an answer when they leave.
No.
Not an answer, but like a thumbs up.
No wings, no thumbs
Because
up.
remember, we're taking it back to the whole commission.
Right.
We're not making the decision at that point right then. We're taking it.
Laurel over here is on the commission as well. Their committee came back and said, this is where we are with this. Feedback. So 15 of us, I guess, were there on Thursday, Friday. We were there Friday. And so we all kind of, you know, that was one that was close. And they didn't want to make that decision without support. So,
Yeah, and also I think the time before that, I think was it we brought the tape back. Everybody had to listen to it. Everybody had to listen to it. So the tape is important before a decision was made. So not only we weren't the only ones on the committee who heard it and then brought back the recommendation. We were stuck, so everybody got to listen to it before we left.
any other questions? Y'all have been fabulous. Go have dinner.
Thank you.